what did you do? He said, I practice pranayama. And this, she told me, just by practicing pranayama, the patient was able to refill the teeth because I have rejected, I have refused to do filling and I suggested root canal therapy. The patient went away and came back with a healthy teeth. So pranayama is that effective. And if it is being practiced along with our vasti, then wonders, miracles happen. So you need to counsel, you need to tell them that this is only our responsibility. Treatment we will do. Other two things you have to do. So eat fruits, dry fruits, milk, ghee, vegetables, buttermilk, freshly cooked food, and different millets and other things, other grains, whichever grains are available in your area. Healthy things, healthy vegetables, healthy fruits, all those things which are there, cook them properly, moderate cooking, and then eat them. Avoid fried food, spicy food, oily food, reheated items, pickles, potato will increase vata, pumpkin also increases pain, jackfruit also increases pain, banana increases pain, solid curd avoid, take takra, tomato, non-vegetarian food, cool drinks, chilled items, processed food, preserved food, reheated food, refrigerated food, all these things will say no until your MRI shows that you are normal. And of course, sleeping by 10 p.m., getting up at least by 5 a.m., breakfast before 8 a.m., lunch before 1 p.m., dinner before 7:30 p.m., avoiding pollution, spinal exercises to strengthen backbone and spinal cord, regular pranayama, meditation for regeneration of cartilage and bones, prioritizing life, which helps in reducing stress and tension. So this part will be covered by Shivashankar ji. Life part will be covered. So always Vishwarath Parishad people ask us to bring some motivational speaker. So we bring only people from CHDHC, Center for Holistic Development of Human Consciousness. We have a group. We teach what Shivashankar is teaching. It is called Universal Human Values or Jivan Vidya. So once people understand, they will understand how to live happily without stress, whatever might be their situation. They will take command over their situation. So for that, classes of Jivan Vidya, avoiding foods grown outside using pesticides and fertilizers. So we spoke about, again, today is World Environment Day. So it is our responsibility to communicate with farmers who are doing organic farming. If you have friends who are doing organic farming, if you have friends who are having Indian cows without any hormonal injections, then you are the richest person. Even if you don't have a lot of money, if you have friends who can give you good food, good milk, good vegetables, good fruits who are growing, and you have friends like that, then your life is blessed. Your family is protected. Even if you have crores in your bank account, you are eating chemical food, chemical fertilizers, chemical pesticides and all those things, and food you are eating, you are doomed to be a patient. Eating that food is a recipe for disaster. Of course, we will tell them how to correct their spinal posture and what happens when they use the cell phone for a longer period, and what is the right posture. The angle between the spine and the thigh should be 90 degrees. The angle between the thigh and the foreleg will be 90 degrees or more than 90 degrees. Monitor should be exactly opposite to the face. And but normally what people do is they'll do like this, work like this, keep their feet inside their chair like that. Less than 90 degrees angle in the knee joint is also bad. Less than 90 degrees angle at this joint is also bad. When you are lifting something, you should not bend your back and lift when you have a disc problem. All these things will tell them. So many precautions will tell them. And of course there are this Bhujangasana, Shalabhasana, the Shalabhasana, all these things. Naukasana will teach all these things. Neck exercises, static exercises, dynamic exercises. All these things will teach them. Stretching, all these things while the therapy is happening, will teach them. So the thing is, I have PPTs for all the diseases. If I have time and the patient is not convinced, I'll open my laptop and I'll explain. I'll convince in such a way that they will be ready to do whatever therapy I will suggest. Okay. Meanwhile, the patients, old patients will tell them, Doctor Saab will burn your skin, he will do Agni Karma, and they get afraid. So they, or like some people will tell, when the patient tells, na, they tell that he will do that, but immediately the pain will not be there after some time, and the pain will just disappear after Agni Karma. Like that, they will do, they will tell, and it's okay. But sometimes no one will tell them what is Agni Karma, or I don't write Agni Karma, I write Vahini Karma. So patients are curious, they ask us, what is Vahini Karma, what is Vahini Karma, what is Vahini Karma? So then I'll tell them, we have a special instrument made out of Panchalohas. It is called Panchaloha Shalaka. We transfer thermal energy from that instrument to your skin. Through the skin, it will go to the deeper tissues, and it will facilitate regeneration and fixing of the disc there. How do you transfer thermal energy? We will create the thermal energy and we will transfer. They will ask 100 times. I will never tell that I will do a what we call in Telugu we say Vata. Vata pedatan and cheppam. We will not say we are burning it. We will say transfer of thermal energy. So it is very important for us to communicate in an effective way and make them understand that whatever we are telling is scientific. And it is proven beyond doubt that regeneration is possible. It is proven beyond doubt that vastis are very effective in regeneration. It is proven beyond doubt that panchakarmas will remove the toxins which are responsible for degeneration. So many researches are happening. It is our responsibility to create awareness in public. Otherwise, who will come for 45 days? Who will undergo all these difficult things? If the person is referred by a patient who already got cured, he will not ask any questions. But if a person casually comes, many people search in the internet and they come directly, walk-ins. They'll say, no, I don't have time. Can I come only in weekends? I can come only twice in a month. I'll say, no, it is not possible. You can take some medicines, but it will not solve your problem permanently. If you want a better solution, you have to come daily and undergo this therapy. Then he'll say, it is not possible. If you go for surgery, you have to take bed rest for anyway 1 month or 2 months. Na? Think of it like this. You don't have to go for surgery. You don't have to even take bed rest completely. Many people, they come, take therapy and go to the office also. Okay? We make it convenient for them. And we make them follow all the rules. When they are taking Snehapana, we will give them strictly all the list of all the things we have to do. No hot water, no cold water bath, no cold water drinking, drink only hot water, take bath with only hot water, no head bath, no sleeping in the daytime, no jagarna in the night time, no, and brahmacharya, no physical activity. All these things we give a list and we make them, if you can do this, go to home, otherwise get admitted. Like that. So it is our responsibility to convince them, make the therapist convenient without compromising with the principles. I never compromise. I do as Shastra says. I never compromise. And because we are doing as per the Shastra, we are getting best results. Right? So it is our responsibility as Ayurveda doctors to spread this great knowledge. Recently, Anjaney Murthy sir told me that he is trying to influence the government to declare World Ayurveda Day, like World Yoga Day. June 21st, we are having World Yoga Day. Similarly, World Ayurveda Day. What a wonderful thought, actually. See, yoga, now even in Muslim countries, people are practicing yoga. And they understand yoga is very good for preserving their health. And why not Ayurveda? Ayurveda is all about minutest details about how to live a life. No other science will tell us what clothes to wear, which color to wear in which season, what music to listen, what work to do according to your own constitution. So many things just to make you and keep you healthy. So if everyone in the world knows about this thing, we are spending around, See, 60% of doctors are facing mental health problems according to survey in Cardiff University. Doctors are facing mental health problems. A research by Dr. Douglas Mata at Harvard Medical School, comprising of 54 studies, says that 29% of young doctors and medical students suffer with severe depression. See, if that is the case with doctors, what about others? So the world is like this. So it is our responsibility. Who else is the better person to tell this world about health than an Ayurveda doctor? It is our responsibility to tell them how to stay healthy. Because every year, now a recent report says that every year around $5 trillion is being spent by governments to treat diseases. Modi ji is trying hard to make our economy $5 trillion. But every year more than $5 trillion are being spent to treat diseases. We can save a lot of money being spent on unnecessary medicines which are in turn causing so many complications. Right? So it is our responsibility being Ayurveda doctors. See, meta-analysis of huge number of studies says that adverse drug reactions are the 4th largest cause for mortality. These medicines are causing deaths. And who can avoid, who can prevent these deaths? Us, we can protect these people from getting complications due to the medicines they are using. It is our responsibility. And non-communicable diseases are killing 40 million people each day. 75% of deaths, all deaths are due to non-communicable lifestyle disorders. Because the lifestyle is bad, people are dying. 70% deaths are due to 80% of premature deaths are attributed to lifestyle disorders. So many people are dying because of the bad lifestyle. So is it not our responsibility to correct the lifestyle of people? ఎవరికి ఇక్కడ తెప్పించేసి ఆరుగురికి. So it is our responsibility to educate people. So we should learn our Shastra properly and we should also learn how to communicate properly, how to create an effective impression on the patient. Once a patient comes to me, it's not just the medicine I give them enough counseling that they will never get sick again. We will teach, that is what we are teaching. Every month we are doing Ayurveda Yoga Shikshana Saptaha, 7 days of workshop we are conducting where we teach Swasthavritta and also some Gruha Vaidya, so that they will not fall sick again. Then you might say, if he doesn't fall sick again, what will happen to our business? Don't worry, there are enough people who are ignorant in this world. The person who is healthy, he himself is making giving enough publicity and bringing so many patients to us. You might have observed those people who came on 1st June, there was no name board of Arogyadayatri on our hospital, right? When you were here only, we have fixed the board. So we started this hospital in 2017. Till today, we were not even having a board. People are coming. How they are coming? People who got cured, they are bringing more patients. That is the best form of publicity, right? So I rest my case here and I request Anjaney Murthy sir to give me some inputs. I am eager to listen, sir. Thank you so much for your patient listening.
In my career as a government teacher in Mysore, there is a provision for studying MS Sanskrit. This Mysore University was having one Sanskrit department. They were teaching this Sanskrit. Means what happens is they send lessons and there will be 15 days intensive course. So at that time they were studying all this Bhavabhuti, Kalidasa, Bana and all these things. One particular statement comes there. That word is called as Dharshyam. Dharshyam means in Sanskrit literature one word comes as Dharshyam. In Ayurvedic literature also similar word comes. Jajata has written one commentary on this Charak Samhita. It is called as Nirantara Padavyakya. I was asking one question, I not got the answer. Maybe I'll get the answer before we leave this place. I'm just, it is there my tip of the tongue, but I want you people to give the answer. I asked one question, what is the commentary of Chakraparni and Sushil Samhita? Okay, I'm not giving that answer, I'm giving another answer. That is, Jajata has written Nirantara Padavyakya. So a wonderful commentary. When we are studying, it is not in printed form, but Dr. Vastra is having that copy of Nirantara Padavakya. He is sitting at the back. I don't know how he got that book. It is there. Original book he has got. It is a wonderful book. See, each word has been broken into very, very decent way and explained in a very great manner. Dr. Sundar has given some exclamatory remarks about me, about Basti and other particular things. Maybe if I tell too much, it will be overload, but little by little, I will be telling small things. Okay, so that it will not overload, but it will be learning new things. In the Charaka Siddhisthana 4th chapter, it is called as Sneha Vyapas Siddhyadhyaya. This Jajata is giving a wonderful commentary. Can't imagine, we can't go beyond that. Even if you think far enough, you can't go beyond it. I'm just quoting Jajata's commentary. Your college is having a Jajata's commentary or not, I don't know. You catch hold of Dr. Vastra sir and take that book and see what is happening. Okay, I'm just telling Jajata's commentary. He is telling Agnisthana is at the upper level. No, you are giving materials through the rectal route. Correct? But when you are giving the material through the oral route, I'm not talking about Dr. Sundar, but what is coming into my mind, I am telling, that is all. When we are giving through the oral route, it is possible for gastric lipase to act, enteric lipase to act, the bile should come, it should do the emulsification. No, so many things happen in the digestion metabolism. But what happens when you give through the rectal route? Something should happen, no? For body to respond, something should happen. What is happening? Question and answer is there by Jajata. I just want to, without adding my own words, I'll put Jajata's words into English. It is Sanskrit language, I'll put in English. He is telling, Agni is at an upper level. We are giving this bastis from the lower level. No Sakshat Sambandha is there between Agni and this material. We know that Agni has got Urdhva Jalana Swabhava. Correct? In Rasa Paribramana, Dalana is telling Shabda Archi Jalasantanavat. You should understand why he is using 3 words. Shabda Archi Jalasantanavat. 3 words. Very immense things. Jalasantanavat means Jala flows from the upper and the lower. Okay. Archi Urdhva. Shabda Vichitarangana always. See, in 3 words, he is describing everything about Rasa Paribramana. Can you imagine? Can you try to forget these people? You try to put your own words. Maybe you can't beat those people. They are excellent people. Okay. Similarly, when Agni is considered as the Urdhva Jalana Swabhava substance, how is it that the material at the lower end is acting? Then he is mentioning, I'm just putting my words again. You have got this Urdhva Patana Yantra, Adha Patana Yantra, Tirik Patana Yantra and Rashastra. So, in Adha Patana Yantra, what you are doing, there is an upper part, lower part, and over the upper part you are putting the fire and you are putting some smearing, some medicines. Thus Agni, because of it is touching the surface, it is acting on the upper part and materials are coming to the lower part. Similarly, here Agni also is acting. Here, Pachana is not taking place. Shoshana action is taking place. So he is mentioning, I am not using word Pachayitva. He is telling, Acharya is telling, I am not using Pachana word at all. I am using Shoshana word. Can you understand? Soshana word. We'll keep that Soshana word. So please understand, he is not interested in Pachana, he is interested in Soshana. This is the Charakas and Jajatas and Chekapani's commentary. Two different things are there. How to understand this Soshana? One question is going to arise. He is telling, you go, you take some sand, and over the sand you put water. When you put water, any digestion is taking place. That water is observing. Soshana is taking place. He is telling, Yata ambu sikatayu iva. Yata, I am putting English words. Ambu sikatayu means sikata means sand. You put water over the sand, so the water is being absorbed. Similarly, in the person who has got Vata Prakopa in the Kati and Vankshana Pradesha, Ambu Sikataiva Soshana is taking place. In those particular people who have got Kati and Vangshanagata Vayu, you can give Basti Dine Dine. Every day you can give Basti. When you give every day, what is going to happen? That Soshana is going to take place. That is one context. Second context is telling, Ato Anyesham Traham Pachati Pavakaha. Every person is not having Prakopa at the Kati and Vankshana. There are some other group of people who do not have Vata Prakopa at this area. In those people, Ato Anyesham Traham Pachati Pavakaha. In other people, Sneha Paka happens after third day. Two classes of people. Soshana people, Pachana people. Okay, we understood. But how Pachana takes place? Because there is no direct relation with Agni. He is telling, Bahir Nisrutena Ushmana. Some unused enzymes are there which are coming from the upper tract to the lower tract, and Bahir Nisrutena Ushmana means what? Unused enzymes. He is using somewhere before this enzyme word itself was there in the allopathic dictionary. Enzyme word would have come some years back, I don't know. Before the enzyme word was there, these people is using Bahir Nisrutena Ushmana. Ushma is coming from the upper tract to the lower tract, and this is able to digest. Are you following me? Then even modern physiology tells, no, this is all bogus. This is all bogus. Everything happens in the small intestine, large intestine, nothing is happening. What is happening? In Byko, B-Y-K-O, Byko, physiology, Byko has written on physiology book. He is mentioning in this particular physiology context itself, you should refer that book. There is possibility, a very remote possibility, not everyday possibility, that the unused enzymes may come down from the upper tract, and those unused enzymes are capable of digesting. So keep this Bahirnisrutena Ushmana and keep this unused enzyme theory. Always quarrel will be there. Whether it is right or wrong, quarrel will be there. Whatever things are there, let us try to understand the inside depth what he is trying to tell, and try to understand this. Let us go beyond this also. So, in the people who have Vata Prakopa, Anvastan Basti, Dine Dine, in other people, 3 days once. Conclusion what? After all discussions, quarrels, intellectual discussions, quarrels, one sentence conclusion is, in Vata Prakopa conditions, you can give Anvasana daily. In other people, you can give this 3 days once. Okay. Now, for everything there is a limit. For everything there is a limit. If you look at the Basti evolution in the West, they were giving this Basti to the animals also. They were so fond of this animals and they got very good results by Basti. They were giving this Basti. So they developed so many instruments of Basti, hydraulic instruments, mechanical instruments, so many things, and they wanted the Basti material to be retained for more time inside the body. But Ayurveda never wanted that to remain. They failed. Allopathic people failed, but Ayurvedic people succeeded. Why they succeeded? The reason is, we have what is called as Niruha Yogya people. Niruha Ayogya people. Anvasana Yogya people. Anvasana Ayogya people. And if you look at the whole book of pharmacology, Satoskar Bhandarkar pharmacology book is there. He is mentioning one particular word. I want you to, one key word he is mentioning. Whatever can happen through the oral route can happen through the rectal route. Whatever can happen through the oral route, it can happen through the rectal route. But it is erratic. He is mentioning erratic. Means one switch is there which is having loose connections. Sometimes if you put on, light will come, sometimes it will not come. It is called as erratic. So Satoskar Bhandarkar is telling the effect of the Basti is erratic. Okay. Once it what, so I am giving this lecture, I am quoting Satoskar Bhandarkar. That Satoskar's son is there in the gathering. And he is an American citizen. I don't know he's Satoskar's son. But I'm not telling anything wrong, but he's laughing, just smiling and laughing. Then after the meeting, sir, you're talking to Satoskar's son, he's sitting, and then I went to him, sir, did you get offended that I'm speaking something? No, you're speaking correctly, what is wrong? He didn't take any offense, he felt very happy. Then I told, I want to meet your father. His father stays in Bombay. Then he told his father is 90 years, 95 plus, very, very sick and aged, I have to take his permission like that. So my point is, we can talk to the highest people, we need not feel offended. I am quoting Satoskar Bhandarkar book and I am talking to his son, but he did not take his offense. But we should speak truth. My point is truth. Truth in an unoffensive language, nobody takes offense. Now, totally we will come back to original thing. Basti can be given in Vata Prakopa conditions every day. In other people, 3 days once. Keep this aside. Now, look at this Matra Basti concept. Matra Basti is mentioning Adva, means who is walking much. Vyavaya, Vyayama, who is doing excessive Vyayama. My question is whether we can give this type of basti for sports people who do marathon walking, who climb hills, who want strength in their legs. Can you imagine? And if these people are given this type of basti, they can walk better, they can walk faster, their muscles are going to improve. Are you following me? Look at the beauty of Ayurveda, look at the expanse of Ayurveda, look at the possibility of Ayurveda, where all it can go. Okay. Now, the modern counterparts are giving steroids and all sorts of things, wherein the urine sample is taken and if prohibited drug is there, he is disqualified. But if basti is given, nobody is going to disqualify, but definitely his performance level is going to improve. Look, but please understand what is called as Parihara Kala. Parihara Kala means you are giving Yoga Basti. After giving Yoga Basti, you tell him you run. No. There is what is called, suppose you are giving Yoga Basti Parihara Kala, 8 days, 16 days is Parihara Kala. Means double the time you should Parihara Kala. If you don't understand, you will fall. Not only you will fall, the patient will fall and everyone will start scolding. So understand the subject properly. Please, my request is understand the subject properly. If you don't understand the subject, you will start scolding the subject. Are you following? Don't scold the subject, understand it properly. So after 15 days, you do experiment. जैसा हम क्या बोलते हैं, roof, you do curing for 21 days. Over the wet roof, nobody goes and does dance there. After curing, he will do it, no? RCC is very good means after curing. I will tell Parihara Kala is like curing. In the body, you are doing so many things. Everything has got validity. Everything has got validity. Today I did Vamana, correct? In Vamana, Parihara Kala has been told. In Vamana, Samsarjana Krama has been told. Why Samsarjana Krama has been told? Can anyone tell? Meer cheppadandi. Why Samsarjana is told? You can take mic and tell, please. You can come here a little bit because you will be talking to these people. If you tell wrong, nobody is going to scold you. Nobody is going to scold you if you tell wrong. Please come here and tell. You tell your name and tell. What is the purpose of Samsarjana? Samsarjana. Can anyone improve upon the statement? Come here. What is the purpose of Samsarjana?
So to improve the acne, so we can start some slowly by then maybe next year.
Anyone can improve upon this?
So all the enzymes, even bile are come out by the process. They don't. All the pitta also come. No enzyme is there by this process. So restore all this, we have to give light.
Actually, very, very tricky questions are there and tricky answers are there. These are actually PhD level questions, not even MD level questions, but we are asking you PhD level questions because you have come to this Gurukula for Sundar means you are PhD students, correct? But what happens is don't test your knowledge of your teachers. Once you go back to your college, don't test. For heaven's sake, don't test the knowledge of teachers. They'll start scolding Sundar and me and everyone. Don't, just keep quiet. Keep quiet. If a good and intelligent person comes to you, talk to him. That is all. It is not the teaching or teasing the teachers. See, in Virechana and in Vamana, what is happening? Shroto Vishuddhindra Samprasado, words have been told. Their Agni Dipti has already been told. By doing Vamana and Virechana, Agni Dipti is taking place. When already Agni Dipti is taking place by Vamana, what is the necessity of doing Samsarjana? Either that shloka is wrong or Samsarjana shloka is wrong. Samshodhana does Agni Dipti, it does Shroto Vishuddhi. When it is doing Agni Dipti, why are you giving Samsarjana again? Are you following my question? Have you understood my question? Okay. We'll keep that question aside, we'll give that answer. And in my answer also, some typical difficult points are there. He has used some words, those words have a lot of meaning. Yata Truna Gomayadyehi. He is using word Truna Gomayadyehi. He is not using Gomaya Trunadehi. Truna Gomayadyehi. When fire is having little quantity is there, all ash was there over that fire. That you have by Shodhana, you are removing the ash. You blow, no? In the ancient times, we used to blow with some pipe like thing. Similarly, what does it do? All kalmasha, kasa, everything that is there over the gastric fire is getting off by your Shodhana. But fire is minute, very little quantity. So over that fire, what you do? You take dry grass. And once it becomes strong, you take Gomaya, Churna and other things. So he has used Truna Gomaya Dehi. Yatha Agnihi Bhavet, Mahan and Stiraha. Two very, very key words. Mahan and Stiraha. If one word is sufficient, he should not have used two words. Truna Gomaya Dehi. Agni becomes Mahan, means very big. Very big, capable of destroying the fire also. Forest. In the forest, small fire starts. If you don't take care, full forest gets destroyed. That is called a Mahan. Similarly, this small Agni becomes Mahan. So, okay. Stiraha. Stiraha means what? See, small lamp is there. If you put a big fan, that lamp will vanish. But Sthira Agni will not go with fan. You could, in a forest fire, if you put fan, I think fire will burn more stronger. Are you following me? In the similarly, by Samsarjana Karma, Agni becomes Yata Truna Gomaya Dehi, Bhaved Agnihi, Mahan Stiraha. Dr. Sundar was telling by heart shloka, I was telling, no. If you don't know this Truna Gomaya Dehi, Yata Bhaved Mahan Stiraha, that should be printed in your brain, no. If it is printed in your brain, you can see in the patient and you can tell to the people. Each word that is there in the shloka is very, very powerful shloka. Neither you have got the capacity to remove any word, nor the capacity to add any word. That is the beauty of these things. Okay. Now, here what is happening? We're talking of Basti, I explained. We're talking of Vamana Virechana, we're talking of Samsarjana, and after Vamana Virechana, you're doing Samsarjana. I was talking about Matra Basti, and I was talking about Parihara Kala, I was talking about RCC. Similarly, this Matra Basti takes some time to do some activity. And after the Parihara Kala, you're supposed to do this. Because I got bitter experience. I'm telling you my bitter experience. One person was there who was doing boxing, fighting and all this. In over enthusiasm, I started government service fest. I caught hold of that fellow. I wanted to give him Basti every day. I gave him Basti, he was very careful over it. But he became more weak. Unfortunately, he became more weak. I should tell my failure stories also, not only success stories. I should tell my that fellow told, I have become very, very weak. What are you doing? So I'm going and fighting every day. In Basti, Vyayama is contraindicated. You are not supposed to do it. Okay? So, where I fell down, you also should not fall down. During Basti, for experimental sake also, don't do Vyayama. Please understand? Experimental sake also, don't do Vyayama. After Parihara Kala, you do it. So, these all whole composite things that have been told in the textbook are really wonderful in the hands of a good physician. Please don't think that Ayurveda is safe. Outside people may tell Ayurveda is safe. Suppose a Chidrodhara case is there, perforated Chidrodhara case is there, can you do Virechana in that? No, Ayurveda is safe. You do Virechana in Chidrodhara. You are not supposed to do it, no. In Jalodhara, Virechana should be done. You do Sambhana Chikitsa in Jalodhara. patient is going to die. In Adhogat Rakta Pitta, Vamana should be done. Instead of Vamana, in Adhogat Rakta Pitta, you do Virechana. It is safe. No, it is not a question of safety. How you select what drugs you select, it is important. So, what is the final thing? Ayurveda is the ultimate sacred truth. For us to understand that thing, we have to reach that level. Thank you. In sum.
There is lot to learn about Basti, not just what the grades we add and how we give the demonstration and skill and all the things, but there are so many other things which we have to understand. And once you practice according to Shastra, you will get wonderful results. That's what Sir is trying to tell us. So please read the Shastra properly, understand all the uses and complications also, and act accordingly, and you will become very successful practitioner with Basti itself. Sir, today in lunch we have today's Vaishak of Chaturdashi, 5th June. We have Purnam Bore made out of Bahrupi rice and fried in Goshala pure basic ghee. Because it is Grishma Ritu, this other oils and all are not advisable. So for frying we use only ghee. And also bhaji also we fried with pure ghee, basic ghee, Alkai bhaji. Then rice is the rice which we eat today, the variety is called Mysore Malligai,
No, from our place.
your place. And yesterday we have taken coconuts from our coconut trees and we have extracted coconut milk, and with that we made Dadyodhana. Dadyodhana without milk and curd. So by Shailendra sir, this formula, that the Dadyodhana is there. With Varsa Basmati rice. Then we have Akke Nachi, Pudina Pachadi, chutney. And Kadambam, there is a special dish called Kadambam. This is Kalagor Papu, Pulsu Sambaru, and Kannagata Pulsu. Kannagata is yam, Surana Pulsu. So please offer. Yes, the popular is source of content. Okay, and never quarrel among ourselves. Always live together in harmony. That is what this mantra says. That is all. Eat together and earn the knowledge together.
See, in India, if one is 1% tax on another person, it becomes 1 minus 1 is equal to 0. In India, if 1% tax on another person, they call it is 1 minus 1 is equal to 0. Right? In America, if 1% tax on another person, is 1 plus 1 is equal to 2. In Japan, if 1% comes to another person, it becomes 11. So all of us can do that. Let us not become 0. Let us not become 1 plus 1 is equal to 2. Let us be 1 plus 11. So Sundar.
We'll have lunch and come back as soon as possible. So Dr. Bhaskar Rao sir is coming. He will demonstrate Telugu Ucharana and Agnikarma and all. So principal of Tirupati College. And then Suchita is coming. We have very good sessions in the afternoon. So please come back by 2. Thank you.